Welcome back, everyone. That was a report on overactive bladders, which is our first topic this evening. And with us to discuss this, we have Dr. Ahmed Al-Badr, who's a consultant of obstetrics, gynecology, urogynecology, and pelvic reconstructive surgery from King Saud bin Abdulaziz University for Health Science. Welcome, Dr. Al-Badr. Thank you for being with us this evening.
Most welcome.
Thank you very much. First of all, if you can tell us, how does a normal bladder work?
Well, the bladder is an organ that accommodates the fluid, the urine, and normally it accommodates urine and stretches and accommodates without feeling any. You don't feel the bladder until it reaches a certain amount, which is around 500, 600 cc's, about half a liter. At that time, you feel that the bladder will start stretching, and then tells your brain that there is urine that it had accumulated. Then you decide that, okay, you need to go to the toilet. And when it's appropriate, and when you're in a private place, then the brain tells the bladder, go ahead, it's appropriate now. The bladder wall contracts, and the muscle that that stops the urine from leakage relaxes, and the urine is passed. So that's the normal process. You start feeling when the bladder starts filling with around 300, 250 cc's, but around when you reach around 500 cc's, the bladder tells you, okay, now it's really time to go.
You start to feel discomfort by 500 cc's.
Not discomfort, like we call it urgency, like feeling that you need to go. You need to go to the washroom. Yeah.
Well, now the topic of the show, or the topic of this segment, is to talk about the overactive bladder. Now, from the definition that I gave before we introduced you, it was basically the fact that the person would have to go to the bathroom quickly. So the name overactive bladder, does it mean that the bladder cannot store as much urine as a normal person, or is it overactive because it just sends signals prematurely?
It could be either. Those people with overactive bladder, that the bladder sensation is more sensitive than the normal person. So they would feel the bladder is getting full earlier than others. So they feel the urgency earlier than others. So sometimes 100 cc's, 200 cc's triggers the feeling that the bladder is getting full. And then it goes, the signal goes to the brain telling them, okay, it's now time to go to the toilet to empty. And that's, so this is basically what we call urgency. So from that, they go to the washroom frequently. So they go to the washroom every hour or so, and hence that's what we call urinary frequency.
So is it just a neurological problem, or is it, well, I wouldn't say neurological, I just mean, because usually when you see people going frequently, the person would say, well, you have a small bladder. Is there such a thing as an anatomically small bladder?
Well, it's not really anatomically. There are some people that have anatomically small bladder, which is after, say, radiation, like radiation for chemotherapy, for instance. But normally, it's basically those people have more sensitive bladder. The bladder is more sensitive, they feel earlier, and sometimes the bladder contracts and start emptying the bladder earlier than it should. The bladder only contracts when you're in the toilet.
All right, well, let's go on a short report on the topic, and we'll be right back. Stay tuned.
It's not talked about much in polite conversation, but for about 30 million Americans, a condition called overactive bladder is a serious problem. We're talking about the urge to go all throughout the day and the night. It can limit your freedom and, frankly, be just plain embarrassing. But now a new FDA-approved treatment is making a difference. For Claudette Henry, something as simple as a short road trip is giving her renewed pleasure. Until recently, it wasn't something she could do without worrying.
I will tell you that I had some embarrassing moments.
It's not a favorite thing to discuss, but she wanted to share her solution. Claudette's frequent need to find a restroom was cutting in on her active lifestyle, impacting her volunteer work and keeping her up at night.
It just was becoming more and more difficult, and I knew I had to do something.
That's incredibly debilitating. And it only takes one accident for them not to want to leave the house. So a lot of these patients are homebound by it.
Claudette had no intention of allowing that to happen to her. So when medication didn't work well for her, Dr. Raul Ordorica told her about an unlikely new treatment, one that begins, of all places, near her ankle.
It sounded really funny. I said, how could anything go in my ankle that would help my bladder? And I'm like, I have not heard anything like this before.
The therapy is called percutaneous tibial nerve stimulation, or PTNS. It works with a device called Urgent PC, and it's designed to reprogram how your bladder is working.
When we go to the bathroom, it's really a reflex, just like a knee jerk. And we're allowing this reflex to happen. Sometimes this reflex occurs without us controlling it. What it does is it gives us back the control over the reflex.
Here's how it works. A tiny needle electrode is inserted above the ankle. The device prompts impulses to travel up the tibial nerve to the sacral plexus and the nerves that control bladder and pelvic floor function. Studies show 12 half-hour treatments tend to offer the best results. Claudette keeps a log to chart her patterns and progress. She noticed changes after the first treatment.
The next day, I thought, geez, I'm not using the bathroom as much. And I thought, well, maybe I'm just imagining that. At the course of the 12 treatments, I was sleeping all night, straight through the night, and that was amazing for me. I mean, I'm like, wow, this is really great.
It can have a huge effect. Suddenly they're able to go out, they can lead a normal life. Were you skeptical before we started this?
Yeah, I couldn't imagine it working.
Okay.
For Diane Heldorfer, the case was even more challenging. Medication alone worked for her years ago until she was diagnosed and treated for colon cancer.
Well, now I feel a little bit going up.
After that, her problem became worse, forcing her to get up throughout the night and having the urge to go almost every half hour during the day.
So I would be timing myself how long it would take me to get to a store or where I was going, and then check out where the restrooms were before I did anything else, and try to position myself around them, every 45 minutes. And it just was ridiculous. So for a while, I just didn't even want to go out.
The therapy Diane and Claudette are undergoing is considered low risk with minimal or no side effects. It is not advised for pregnant women, people prone to excessive bleeding, those who have nerve damage that could impact pelvic floor function, or people with pacemakers. Just 6 treatments in, and Diane is experiencing a major change.
I forget I even have a problem now. I don't feel like I immediately have to seek out where the nearest restroom is. It's the way it should be.
A surprisingly simple solution for those who are determined to live life fully.
I can do all the things and everything that I want to do without worrying.
Doctors recommend trying other therapies like physical therapy and medication first. If those don't help or are not enough, PTNS may be the answer. The 12 treatments cost about $1,500. Some insurance companies are covering the treatment. Medicare in Florida covers it on a case-by-case basis.
Welcome back, everyone. And that last report was talking about overactive bladders and treatments, particularly for overactive bladders. And now we're back with Dr. Ahmed Al-Badr. And Dr. Ahmed, if you could perhaps tell us more about how to treat overactive bladders.
Once the diagnosis has been established by the treating physician, there are simple measures that we usually start with. We ensure first that there's no urine infection. If there is, we treat it. We try to make sure that the bladder completely empties, because some people, the bladder does not empty. They go to the toilet, it does not empty. And with that, they feel the bladder gets full quickly. So if that's the case, then we need to treat that specifically. Now, if we find just there, what they have is what we call overactive bladder, means that they just feel the bladder fills quickly, or they feel sensation of bladder filling quickly, which we call overactive bladder, then we start treatment by advising them to reduce the amount of caffeine they take, because caffeine irritates the bladder. Caffeine, smoking, alcohol, all those they irritate the bladder. The other thing we advise them. Some of them reduce fluid intake because they want to reduce the amount of urine they produce. On the other hand, some concentrated urine could irritate the bladder. So we usually advise them to drink enough fluids, and mainly water, around 1.5 liters, 2 liters per day. So I reduce caffeine, enough fluid intake, and then we go to something called bladder retraining or rehabilitation, where we try to get the bladder to fill and to train the bladder to fill enough urine. So instead of going every hour, we try to get them to go every 2 hours by gradual increase in the amount of or the number of times they go to the toilet. We also advise them to do what we call Kegel exercises, which is the pelvic floor exercises. Strengthening those muscles of the pelvic floor reduces the sensitivity of the bladder as well. Now, those are the simple measures that we usually start with, and then afterward we go to medications, and there are several types of medications. They're called anticholinergics, which they block the cholinergic receptors in the bladder, the receptors in the bladder. And when those medications are taken, they relax the bladder wall, so they reduce the sensitivity of the bladder, and they make the bladder accommodate more urine. So we usually advise taking those medications with the simple medications, which are with the simple measures of bladder retraining and exercise. Now, good number of people do respond to those simple measures, and if they don't, then we carry on. We go to the third line treatments, one of which was shown on the report, the urgent PC. Urgent PC is basically one of the treatments where you stimulate the nerves in the ankle, and that nerve regulates the bladder nerves. With that, it helps regulate the bladder sensation. There's another way to stimulate the nerves also by placing leads in the sacral area, in the lower spine, and again stimulating those nerves also regulate the bladder. A third way to treat as a third line, again, when medications do not work, is by injecting the bladder wall with a medication called Botox, which is the same medication that used in the face for cosmetic procedures. But we use it in the bladder to basically try to paralyze or try to reduce the activity of the bladder wall. And with that, it reduces the sensations of urgency, frequency, and incontinence when it's there.
Well, now, basically, first of all, the thing that most people must try to do, if any of the viewers are feeling overactivity of the bladder, the first thing that the doctor would tell them to try to do are the exercises you explained, and avoiding caffeine, avoiding alcohol, avoiding actually increasing the water intake.
Taking the
that would lessen
amount.
the irritation of the bladder.
True.
But the exercise to increase the pelvic floor, how would you go about those exercises? And for anybody who hasn't seen a doctor yet, if this is a measure that may prevent them from actually needing a doctor, what would these measures be?
What we call the Kegel exercises or the pelvic floor exercises, these are the muscles that wrap around the pelvic organs in males and females, but in females they play a much important role. So they wrap around the pelvic organ, the bladder, the urethra, the vagina, and the rectum.
These are the pregnancy exercises that women would normally do.
Exactly, yes. Those exercises we recommend them during pregnancy, after delivery, and in people who they have or to prevent even having pelvic floor dysfunctions such as overactive bladder or urinary incontinence. So those are basically exercising those muscles by contracting, relaxing, about 10 to 15 minutes twice a day. Those muscles are the same muscles that you use when you want to stop the urine. When you're however, while exercising, you should not do it while you're in the toilet. You could identify the muscle when you're in the toilet, once or twice. But then when you're exercising, you should do it anywhere else, not in the toilet. they're done in any position, sitting position, lying down position, or standing. I mean,
Yeah. So by contracting and then
contracting,
releasing,
relaxing, contracting, relaxing, about 10-15 minutes.
Mhm.
Yeah.
And
Muscle.
if the overactivity does not cease, then after, let's say, 2 weeks, and still overactivity, then they should go see a doctor.
Well, exercises take at least 6 to 8 weeks to work. So, like exercising any muscles,
Oh,
like
yeah.
when you're going to the
Alright.
gym, when you want to get the muscle to hypertrophy and become stronger, it takes about 6 to 8 weeks. So, usually, to give time for the pelvic floor exercises to work, we need that time period. Yeah. Plus the other measures of fluid and retraining the bladder to accommodate more urine.
Well, Dr. Ahmed Al-Badr, thank you very much for joining us on the program and sharing this information with us.
It's my pleasure.
Thank you.
Thank you.
And that was our guest, Dr. Ahmed Al-Badr, the consultant of obstetrics, gynecology, urogynecology, and pelvic reconstructive surgery, joining us, talking to us about overactive bladder, and also gave us some tips on the first measures of treating an overactive bladder. Again, we'd like to thank him for joining us, and right now we're going to go on a report, and we'll be right back to introduce our second topic for the evening. Stay tuned.